Ms. Miller-Meeks.
Thank you very much, Madam Chair. Dr. Davidson, in your testimony, you mentioned that today's college students are not the typical 18-year-old high school graduates that are looking to complete their degree in 4 years. I know that well as being an older student going to medical school. They are largely non-traditional students coming from all walks of life, often with some post-secondary education experience and likely balancing other responsibilities, such as working 1 or 2 jobs in addition to their studies. As such, it seems as if our post-secondary education system is failing as it's modeled after serving a student population that is not reflective of this current landscape. How should institutions adapt to this reality and meet students where they are in their lives rather than where they think they should be or have they've been in the past?
Thank you very much for that question, Representative Miller-Meeks. It is absolutely true that our students do not fit that full-time 4-year stop full-on model. Most of our students are working 30 to 40 hours a week. And what we think that higher education needs to adapt to fit their zigzaggy and complicated lives. And ways that you can do that is to, number one, partner with industry to make that work experience that they're already doing towards their career. So if you're flipping pizzas, maybe you should get an internship instead with an industry that you're thinking about working in as you move along. Higher education needs to adapt its curriculum for that. It needs to partner with industry left of that graduation timeline so that the students can have a relevant experience along the way. And another thing that we do is we have to change the way we talk about college. If you come into college and you have, 2 kids and a full-time job and you've plotted it out so that you can afford it and you can get through in 4, 5, 6 years, but you're constantly being told that you're behind the normal timeline, that's very sort of demoralizing for our students. We need to chart the courses that fit into their lives as opposed to the other way around.
It sounds like my father when he talked about the School of Hard Knocks taking 20 years to get his bachelor's degree. What are some other federal policy changes that could be made to help bolster reforms that institutions are making to meet the demands of today's students?
Yeah, thank you for that too. We try really hard to be efficient. And one of the biggest inefficiencies, ironically, is that FAFSA process. Anything that we can do to simplify that process will allow me as the president to put resources on the things that matter, on those high impact practices that get students over that finish line. We spend a lot of time and staff and funding actually helping students fill out a form just to prove that they're poor. I think we can do better as a nation and not leave that funding on the table for those. And another thing that I think is really important is anything we can do to enhance and grow work study. As you can tell, I'm really passionate about this idea that students have an experiential learning opportunity with industry that is career focused. Anything you can do to expand that opportunity for students would also be very, very helpful.
I found that in your testimony that you had given, and having been a nurse prior to becoming a physician, I saw the shortage in healthcare professionals before COVID-19 and now due to COVID-19. As a physician myself, I can speak firsthand to the challenges healthcare providers face. And it's important that as we recover from the pandemic, that we improve our healthcare workforce pipeline. In your testimony, you mentioned how MSU is scaling up its College of Health and Applied Sciences to fill the gaps in our healthcare talent pipeline. Can you elaborate on what this scaling up looks like and what MSU is doing to recruit and retain students?
Absolutely. Even before the pandemic, we knew that healthcare was in a bit of a crisis. Lots of students who want to be nurses, for example, huge demand for nurses. The logjam is higher education. We cannot get that throughput. And unfortunately, the logjam inside the logjam is infrastructure. And so what we're doing is we're trying to partner with industry and also with our state house and donors to really build out our infrastructure for our nursing and our health institutes professions. Having nursing simulation labs will allow us to double the number of nurses that get through our program. And I don't have to tell you, but for every physician, there are 16 other professions that are required. And we're focusing on those in an integrated way as well with our health institute.
Thank you so much for that. And I thank all the witnesses for their testimony. And Chair Wilson, I yield back my time.